Have you ever been driving and you see a billboard that catches your eye? I recently saw one while driving home. This billboard read, "Do you know your ABCs?" This billboard was specific to SIDS awareness. SIDS is an acronym for Sudden Infant Death Syndrome. According to Centers for Disease Control and Prevention, in 2016, there were 3,607 cases of SIDS in the United States alone. In this informative speech, I will be discussing what sudden infant death syndrome is, what can be a cause or multiple causes of SIDS, and most importantly, a few things that can be done to prevent a baby from sudden infant death syndrome. According to the American Institute of Sudden Infant Death Syndrome, SIDS is an unexplained infant death resulting from an unknown medical abnormality or vulnerability and is usually classified as a natural death. SIDS is related to accidental suffocation. Accidental suffocation is a death resulting from a full or partial airway obstruction, causing death from oxygen deprivation and an increased carbon dioxide, and is classified as accidental. Most cases of SIDS versus accidental suffocation are impossible to make a definitive classification. In the United States in the last 20 years, there has been a decrease in deaths classified as SIDS and an increase in those classified as accidental suffocation. The ABCs of SIDS are widely recognized, though not everyone is educated about why the 3 letters are so important. The 3 letters are A, alone, B, on their backs, and C, in the crib. You are to never allow a baby to sleep with anything, pillows, quilts, soft toys, loose objects, etc. The A for alone is for no co-sleeping. Sleeping with a parent or somebody else gives them possible smothering. B for on their backs, our baby should not be on their stomachs unless it's tummy time while they're awake. And C, in the crib, is on a firm mattress with only the mattress and a fitted sheet. According to Mayo Clinic, the causes are a combination of physical and sleep environmental factors that can make an infant more vulnerable to SIDS, and factors vary from child to child. Physical factors include infants born with brain defects, low birth weight, as in premature or part of a multiple birth, and respiratory infection because this contributes to breathing problems. This picture shows the difficulty an infant has breathing in the prone position. When they're on their stomachs, their face is down and it blocks their airway. Some sleep environment factors are sleeping on their stomach or side. The positions may cause difficulty breathing, sleeping on a soft surface, sharing a bed, and overheating. Some risk factors include the sex. Boys are more likely to die of SIDS than girls are. Age. They're most vulnerable within the first 2 to 4 months of life. Secondhand smoke, and family history. According to the American SIDS Institute, they give specific tips on reducing the risk of sleep-related deaths. Some of the prevention tips are: 1. Decrease infants' medical vulnerability. This means to research and make yourself aware of any genetic abnormalities, brain abnormalities, and prematurity. Keep the child's airway free. Avoid co-sleeping, cluttered cribs, and stomach sleep. 3. Don't do anything to decrease infants' arousal. Avoid overheating, infections, and sedation. And don't do anything to decrease parents' arousal. Avoid alcohol and drug sedation. This picture shows a sleep-safe environment. It shows they are alone, no heavy or loose blankets, no pillows or toys. Their feet to foot, they're supposed to be at the foot of the bed, and they're on a firm mattress. According to Eunice Kennedy Shriver, National Institute of Child Health and Human Development, ways to reduce the risk are breastfeeding, sharing a room with parents, but not the bed, and giving tummy time while the baby is awake. The importance for newly expectant parents are preventions during pregnancy, precautions, and knowing what to do and/or avoid with the infants. SIDS is important to be educated about and take precautions to prevent. In conclusion, though there are no signs, you are to follow the ABCs to save a child from sudden infant death syndrome. The ABCs are A, alone, B, on their backs, and C, in the cribs. Now you know what is and causes, as well as the prevention methods. This concludes my speech over SIDS by saying thank you.